Cancer treatments may cause skin and nail changes. Joining me in the studio with some important information and helpful advice is registered nurse and foot care professional Audrey Wall. Audrey, good morning.
Good morning.
Audrey, how does the skin and nail change during cancer treatment?
Great question. Well, cancer treatment basically tries to attack quickly growing cells. Now, our skin and our hair and our nails are also quickly growing cells. So when the cancer treatment reaches the nails and the skin, and what it can sometimes do is loosen the nails, thicken them a little, make the skin a little bit uncomfortable. It can make the feet of our skin of our feet peel a little bit, and it can also create something called chemotherapy-induced peripheral neuropathy.
I was going to ask you about this peripheral neuropathy because it's not just cancer patients that can get affected by it, right?
You're absolutely right. People can have peripheral neuropathy for many reasons. Some can be what's called idiopathic, means it just shows up and we're not sure why. Some people can have it as a result of poorly controlled blood glucose, which is part of diabetes. Some people can have it with many other body issues. But during cancer treatment, the cancer treatment itself can create nerve pain and nerve damage in the fingers and in the feet, which can then induce the neuropathy.
How do we test for it if a patient is saying that their feet are tingling, a cancer patient? How do we test for it?
That is the first best indicator. If a person's feet start to tingle, start to feel numb, maybe can have some sharp jabbing pains in them, I really encourage people who are undergoing cancer treatment or who are just through cancer treatment to speak with their doctor, speak with their oncologist about it, because there are some medications that can be tried to help relieve some of those symptoms. And we usually test with something that's called a 10-gram monofilament. And that sounds scary, but it's just a piece of harder plastic that we touch to the person's foot in different places to see how the sensation is in those spots.
If there is peripheral neuropathy, how do we treat it?
It's a tough one. Medication can help, and for some people who are going through cancer treatment, that neuropathy can come and go. For some people, they never get it. Some people, it lasts and lasts and lasts, and basically they have it for the rest of their lives. Treatment is difficult. Treatment with medication can help. Being gentle with their feet, wearing slippers in the house, wearing padded footwear, keeping their feet warm.
There's a difference between going for a manicure or a pedicure versus going to see somebody who is licensed. Is that right?
Sure. Now, it's traditional aesthetics look more toward the polishes, the treatments, the acrylics. While they do focus on healthy nails, that's often not the end goal for someone when they attend, say, a traditional pedicurist. When you come to see a foot nurse, our focus is more on the healthy nails and healthy skin, and we're not going to put polish on your toenails usually. I mean, between you and me, if you have a wedding to go to, we'll help you out. But our focus is on looking at the person holistically. And so we look at what's going on with the cancer treatment, say, or after, and we are able to treat the nails with different instrumentation and with a different focus.
Now, unfortunately for a cancer patient, they are going through a slew of doctors and a slew of appointments. Why should they really focus on their feet?
Focusing on their feet, well, our feet take us where we want to go, right? Our feet move us through our day. They move us in places where we'd like to go. And honestly, when your feet feel good, you feel good. So if your feet are hurting, it's important to take a look at why they're hurting and to take care of them. So if you can keep them feeling good right from the start, so much the better.
If they're feeling good, what are some signs if they're not looking good that we're looking for if we do a visual inspection?
Well, you just hit it right on the head. A visual inspection is super important for people to take a look at their feet and see if there's anything new or different than what they would expect. Are there blisters? Is the skin peeling? Are there any changes in their nails? Are the nails getting a little thicker? Are they loose? Sometimes cancer treatment can create loosened nails. Don't touch them, don't pull at them, and if they're super loose, wrap a Band-Aid around them just to protect them so they don't come off in sheets or socks. It's all about protecting your feet.
Now, Audrey, your site's under construction, but there's other resources that we can go to. Is that right?
Absolutely. So while our website is being built, which we're going to add lots of resources to, Canadian Diabetes, or Diabetes Canada, has an excellent resource about foot health. And I like to remind people that just because it's cancer treatment or diabetes doesn't mean that the information can't transition from one to the next. It's all about taking care of your feet gently and carefully and being protective of your feet. The cancer societies often have information as well.
Audrey, thanks so much.
Thank you.